On the evening of February 19th, 1994, 34-year-old Gloria Ramirez was rushed to Riverside General Hospital under desperate circumstances. A devoted mother of two and former medical assistant, Gloria had quietly battled advanced cervical cancer for months. Known among friends and neighbours for her warm smile and unyielding optimism, she supplemented her prescribed pain medications with holistic home treatments, seeking any relief she could find. Paramedics found Gloria at her home gasping for breath and disoriented. They administered oxygen and painkillers en route, but her condition remained perilous. At precisely 8:15 p.m., her stretcher rolled through the sliding glass doors of the emergency department. A team of physicians and nurses sprang into action. An IV line was established in her left arm. EKG electrodes were placed across her chest. The attending physician ordered immediate doses of lidocaine, atropine, and epinephrine to quell her dangerous arrhythmia. Monitors displayed her heart's chaotic rhythm, rapid ventricular tachycardia punctuated by irregular pauses. With medications failing, the decision was made to deliver external defibrillation. 2 successive shocks of 200 joules each were administered. Staff braced themselves, but her EKG tracing refused to return to a normal sinus pattern. With urgency mounting, the doctors prepared for additional interventions. Simultaneously, a nurse drew blood from Gloria's central line into clear vials. Within moments, the trauma bay was filled with an overpowering garlic-like odor. Staff looked on in confusion as Gloria's forearms glistened with an oily sheen. Under the bay's bright lights, tiny amber-colored particles floated in the blood, suspended in plasma like foreign contaminants. A pungent ammonia scent permeated the air around the samples. A veteran emergency nurse, holding a vial, suddenly staggered and collapsed to the floor. Instinctively, colleagues rushed to assist, but within seconds, a medical student who had handled the blood also fainted just outside the room. A third nurse, attempting CPR on Gloria, clutched her arm, complaining of burning pain, and fell unconscious. Panic rippled through the bay as staff members experienced throbbing headaches, nausea, pins and needles sensations, and shortness of breath. Recognizing a critical hazard, the emergency department superintendent ordered a full evacuation. Patients on stretchers and their anxious families were ushered into the parking lot under cold night skies. Only a skeleton crew of 4 doctors and 1 nurse remained, determined to save Gloria's life. Even they were not immune. Dizziness and burning skin sensations beset them as they resumed resuscitation efforts. Approximately 40 minutes after her arrival, Gloria's heart finally flatlined. She was pronounced deceased at 8:55 p.m. The death certificate cited acute kidney failure secondary to metastatic cervical cancer as the official cause, yet those present knew they had witnessed something far stranger. In total, 37 staff members had been on duty that night. Of these, 23 exhibited symptoms severe enough to seek medical evaluation. Julie Gorshinsky, a first-year medical student, suffered the most. She was admitted to intensive care for 2 weeks with acute hepatitis, bone necrosis in her knees, and persistent neurological deficits. Her recovery spanned months of physical therapy, and she later became an outspoken advocate against the notion of mass hysteria, citing her confirmed organ injuries and complex medical complications. Media outlets quickly labeled Gloria the toxic lady. The Riverside County Health Department dispatched hazardous materials teams who scoured the emergency bay for gas leaks, chemical spills, and malfunctioning oxygen lines, all to no avail. Infection control specialists conducted exhaustive interviews, documenting the timeline of each staff member's symptoms, their exact locations, and any potential exposures. Their data contradicted early hysteria theories, highlighting clear, physiologically based injuries. By spring of 1994, the California Department of Health escalated the inquiry, enlisting the Lawrence Livermore National Laboratory for specialized chemical analysis. Stored blood samples underwent high-resolution gas chromatography mass spectrometry. Analysts detected dimethyl sulfoxide, DMSO, at concentrations up to 10-fold higher than any documented environmental or occupational exposure. DMSO, once approved by the FDA in the 1960s for topical pain relief, had been withdrawn due to ocular and systemic toxicity. By the 1990s, only industrial-grade DMSO, sold as a degreaser, remained available. Investigators posited that Gloria, desperate for pain control and wary of additional narcotics, may have applied concentrated DMSO topically. This would explain the garlic odor and greasy residue on her skin. With her kidneys compromised by cancer and chemotherapy, the solvent accumulated in her bloodstream. LLNL scientists recreated hospital conditions, exposing DMSO-containing blood to high-flow oxygen and electrical currents simulating defibrillation. The result: formation of dimethyl sulfate, a potent alkylating agent and respiratory irritant. Vaporized during treatment, this gas likely dispersed throughout the trauma bay, triggering acute respiratory distress, neurological symptoms, and collapse among staff. Despite its plausibility, this chemical reaction theory remains contested. Gloria's family has firmly denied her use of DMSO, and no physical evidence, such as empty solvent containers, was ever discovered in her home. Moreover, the in vivo conversion of DMSO to dimethyl sulfate has never been documented in any other medical context, leaving some toxicologists unconvinced. In late 1995, after thorough review of LLNL data and hospital records, the California Department of Health officially closed the case, characterizing it as an unprecedented accidental exposure to a toxic chemical. Riverside General quietly settled lawsuits, implemented updated chemical safety protocols, and introduced mandatory chemical hazard response training for all staff. Today, Gloria Ramirez's story is enshrined in medical curricula as a critical case study on chemical safety in healthcare. The nonprofit founded by Julie Gorshinsky offers workshops on chemical crisis management, ensuring future medical professionals learn from Gloria's tragedy. Each February, Gloria's family and friends gather at Olivewood Cemetery in Riverside to release white balloons and sing Amazing Grace, honoring her memory and legacy. More than 2 decades later, the tale of the toxic lady endures as a powerful reminder. When unconventional treatments intersect with emergency interventions, hidden chemical reactions can pose lethal threats. Continuous training, rigorous safety protocols, and open communication are essential defenses against such perilous surprises in modern medicine.